There are various types of pharmaceutical formulations, and these are administered by various routes of administration. Each pharmaceutical formulation or pharmaceutical drug product has some advantages, unique features, and has some limitations. The pharmaceutical formulations are prepared based on the drug molecule properties, based on the disease condition, and based on the indication. For oral administration, mainly oral liquids and oral solid formulations are there. The oral liquids and oral solids have their own advantages, merits, and limitations. So I welcome all the viewers to this informative video on oral liquids and oral solids formulation. Oral liquid formulations include solutions, syrups, suspensions, and many others. Oral solid formulations include tablets, capsules, granules, powders, and many others. Also, powder for oral solution and suspension are there for the oral route of administration. Generally, the solid oral formulations are stable compared to the oral liquid formulations. They have some more advantages considering the unit dose and the expiry period, or you can say that longer expiry period than the oral liquids. Oral liquids have less shelf life or expiry period than the oral solids. Generally, the oral tablets formulations have expiry period of 2 to 3 years or more. Oral liquids have less expiry, for example 6 months after opening, or sometimes even less than that after opening, or you can say that less in use stability. Generally, the oral liquids have 1.5 year to 1 to 1.5 year or 2 years expiry period, but after opening the bottle, the in use stability period is very less. So this is the main disadvantages. Now see why the oral liquid formulations have less shelf life. Because the liquid formulations contain water, and water may lead to microbial growth. Liquids contain more water, and water can be a culprit for the microbial growth. Oral liquids are water based, or water is used as a vehicle for the oral liquids. Water can support the growth of bacteria, fungi, and molds. That's why it supports the microbial growth. Manufacturers can add preservatives to decrease the probability of microbial growth. The preservatives are there like sodium benzoate, methyl paraben, propyl paraben, but the preservatives can be less effective over time. Preservatives break down over time. That's why the oral liquids may become unsafe. Tablets are dry and these are more stable. That's why these have long shelf life. Tablets contain less water or almost no water, and that's why the formulation becomes stable and less prone to microbial attack. Generally, the tablets formulations are stable more than 2 years, and these don't have the in-use period. These have the shelf life. Dry medicines are longer lasting considering the expiry period. Liquids also have a problem of evaporation, and evaporation can affect the quality. So the evaporation may be there for the alcohol used in the formulation, flavoring agents, and some volatile solvents. So these can evaporate if the bottle is not closed properly. Also during the formal stability study, and if these are not stored properly, considering the storage conditions and labeled instructions. If the liquid evaporates or if the volatile raw material or component evaporates, then it may affect the dose as the dose gets changed, taste and smell effects, and overall effectiveness. If the formulation is oral liquid, made up of the oral drops. Oxygen can break down the oral liquid. Oxidation can happen because of the exposure of the content of the oral liquid bottle to the atmosphere, and oxidation is common in the formulations like iron tonics, vitamins, and some other liquids containing the antioxidants. So, due to oxidation, there may be loss of potency, unwanted chemical changes, change in the description of the formulation. Exposure after opening the bottles. Open bottles have the higher contamination risk. When the oral liquid bottle is opened, it is exposed to the light and air. So, handling becomes critical. You can handle by using the spoons or droppers or the measurement equipment given with the product. Contamination risk can get increased with each use, but tablets generally are coming into the blisters as a pack or bottles, and that's why offering better protection. pH preservatives and ingredients. So liquid stability depend on many factors like pH of the oral liquid, preservative efficacy, and drug stability. In some formulations, some ingredients break down faster in the liquid formulation compared to the solid formulation. For example, vitamin C is a antioxidant and it is unstable in water. Also, tablet can delay or control the release to improve the stability, but oral liquids are not the formulations made to control the release. Dry oral liquids or powders, this is the option to improve the stability. So powder for oral suspension, powder for oral solution are there. Dry oral liquids are stable in the powder form. You can supply the powder for oral solution or suspension and provide the water along with that to mix it with water whenever it is required to be consumed. It increase the microbial growth risk because once the water is used for reconstitution, there will be a risk of microbial growth. Generally, this type of formulations have less shelf life, or you can say less in use shelf life, like 7 to 14 days or as per the dosing regimen, and it is required to follow the label instructions strictly. Like you are storing the powder for oral solution or suspension at room temperature, but after reconstitution, it is required to be stored in the freezer or refrigerator, maintaining the 2 to 8 degrees Celsius temperature. Now coming to the handling of oral liquids. So whenever you are dealing or working on to the oral liquids, always check the expiry, check the labeling instructions, reconstitution instructions, store it properly, use the clean and well maintained spoons, droppers provided along with the packs, and do not use it if it smells bad or looks bad or description is changed or some phase separation is there. So these are the important considerations for the oral liquids and solids. Now coming to the comparison, oral liquids and tablets or oral solids. Water content is high in the liquids and it supports the germs or growth of the microbes, but in oral solids it is generally dry and more stable. Shelf life for the oral liquid is around 6 to 12 months, but it is long for the tablet formulations. Handling is high risk for the liquids. Dosing is required to be done, but for tablets and oral solids, dosing is not required to be done as these are unit dose. Evaporation risk is high in the oral liquid, but it is very less or no risk for the oral solids. This is the information and differences between the oral liquids and oral solid formulations. Also, we have learned regarding the advantages or merits or unique features you can say, and also the limitations. So I hope this video will help you to understand about this topic in more detail. Thank you for watching the video, and let's meet soon with another informative video.